Hello everyone, welcome to MBBS classes. Myself Dr. Hanifa. Today I am going to start a special section for the teachers. Today's topic is microteaching, which is gaining momentum in the medical field throughout the globe. Initially, this microteaching it started as a school's teacher training program. Teachers in the medical schools are not trained in the pedagogic techniques, unlike other educational professionals. And this micro teaching, it is an innovative, effective technique, or you can say a method for training the teachers that helps the teachers to develop their individual teaching skills through the teach, critic, and the reteach model. So, this micro teaching is a teacher training technique for the teachers to learn how to teach. This micro teaching, it is a scaled down session which is meant for training of the teachers. It is scaled down in terms of time of the class taken. It is scaled down in terms of the number of the students they teach, and in fact it is scaled down in terms of the content also. If we look at the history of the micro teaching, this micro teaching it developed at the Stanford University, California in the year 1963 by Dr. Dwight W. Allen and his colleagues. The history of microteaching dates back to 1965 at Stanford University, California, where it was developed by Dr. Dwight W. Allen and his colleagues. And this was started for the secondary teacher training education program. Mainly in the beginning, it was for the pre-service teacher training. Later on, when they found to be effective, this micro teaching method was implied during that time for the in-service teachers also. Then way back about 6 decades ago in the year 1965, they even published their first article, the Stanford Summer Micro-Teaching Clinic. So Dr. D.W. Allen, he developed this micro-teaching method to serve mainly three purposes. The first purpose was to get a preliminary experience, or you can say the practice in teaching, for those in pre-internship students who were planning to enroll into the teacher as a profession. Next, the micro teaching, it was also developed to find out as a research vehicle to explore the training effects under the controlled conditions. And thirdly, later on, when it was found to be effective tool, it was even used for the in-service training instrument for the experienced teachers too. Now, you must be thinking why micro teaching is needed for the teachers. First of all, we must try to understand that teaching is not simply just the transfer of knowledge from the teacher to the students. It is a complex process. If you see that teaching is a complex process which cannot be mastered in a few days. Moreover, in medical schools, what happens? The medical fraternity, or you can say that the medical teachers, they do not get any formal training in the pedagogic techniques, and for them to learn how to teach, the classrooms cannot be used as a place for learning the teaching skills. The classroom is not an ideal place. So you can see that I have given a diagram of the driving school. Many of us must have attended driving schools to learn how to drive, isn't it? So as we know that driving is a skill. For learning the driving, we have to go to the driving school, isn't it? For driving, for to learn, we don't directly go and learn the driving in the highway. Similarly, to learn how to teach, for a novice teacher, the direct classroom exposure cannot be used as a place to develop or to practice their teaching skills. So we need a method. Now, the method, the innovative method, which is being incorporated into the medical education, into the medical training, is the micro teaching. Micro teaching, it helps the novice teachers to focus on the individual teaching skill. So teaching skills, it's not only the one component which is part of a teaching. There are so many teaching skills which makes a teacher. Or this micro teaching, it is also called as the component skill approach. So the individual components of the teachings can be practiced in the micro teaching lessons separately. Moreover, the advantage of micro teaching is that we, the peers, the students, the experts who acts as a students in the micro teaching lessons, we get a genuine feedback or the critics. These genuine feedbacks, the constructive feedbacks, you can say, it helps the novice teachers to improve their performance. It helps them to correct their deficiencies, faults in the teachings, and moreover, the micro teaching lessons, it helps to modify the behavior of the teacher in the classroom. So we have seen that the micro teaching, it is a scaled down teaching technique for the teachers to learn how to teach. Now the question is why it is called so? Because the complexities of a real classroom is reduced in numbers. First of all, here in micro teaching sessions, the class is taken for a very small group, around 5 students. Here, remember, the students, they are not the real students. Here, the peers and the experts, they act as a student. So in a micro teaching lesson, we as a colleague, we as an expert, we get the chance to be the student, and we get the chance to act like a teacher also. Now again, in the micro teaching sessions, the duration of the time of teaching is reduced. It is short. It is around 6 to 10 minutes. It is called micro teaching because here the teaching skill, not all the teaching skills are practiced. Here in one micro teaching lessons, a single teaching skill is practiced. Then after mastering a particular teaching skill, we advance we practice the another teaching skill in the another micro lesson. Then the feedback, here the feedback by the reviewers, it is the constructive feedback which helps us to improvise, to find out our faults. Then after getting the feedbacks, here in micro teaching lessons, we replan and we reteach. Now let's come to the different phases of micro teaching. So you can say that there are 3 phases. The first is this phase of knowledge acquisition, the second is the phase of skill acquisition, and second is the transfer. Now let's see what happens in the knowledge acquisition phase. The knowledge acquisition phase, it is the preparatory phase where the teacher gets trained on the skills or the components of the teaching through the lectures, through the discussions, illustrations by the experts. Next comes after getting the knowledge about the teaching skills. Next is the time to acquire the skills. The skill acquisition phase is the interactive phase where the teacher plans a micro lesson for demonstrating the skills which were taught by the experts. And here the micro lesson is planned. Then after planning the micro lessons, after getting the feedback and all, after replanning the sessions, next comes the phase of transfer. In the third phase, which is the final phase, here the newly learned skills from the simulated teaching situations is applied to a real classroom. So after improvising our teaching skills, the teaching skills is being transferred to the real classroom, that is among the real students. So now let's see the core skills in the clinical teaching. During the initial days of the micro teaching, there were so many core skills which were defined. But today we are just going to discuss some of the very important core skills in the clinical teaching. And micro teaching, it is also called as components skill approach. Now let's see the individual core skills in the clinical teaching. The first and foremost to be mastered is the lesson planning. So what is lesson planning? Here, under this skill, a teacher must be able to plan their lessons, like means what to teach, what must be the content, and the content must be organized in a proper logical sequence. The second teaching skill is the set induction. This skill, it focuses to grab the attention of the learners, that means the students, while introducing a new topic. It means that how do we start the class. The third skill is presentation and explanation. The skill of the teacher is to present the class with the proper clarity, proper explanation, and under this, the components are enthusiasm, planned repetition, and the important message of the class to the class must be delivered. Stimulus variation is another core skill which needs to be mastered. The stimulus variation means to change the pattern of speech, style, gesture. This is done to avoid boredom among the students and moreover to gain their attention. Then the next core skill is the reinforcement. So under the reinforcement, a teacher must be able to identify the difficulties of the students. The teacher must be able to involve their participation of the students. It can be done by using the verbal and the non-verbal cues. The next is the core skills to be mastered are the questioning and the classroom management. That means under the questioning, this, the students, they must be allowed and encouraged to ask the questions, you can say, to clarify their doubts. Now, under the classroom management, the skills is mainly to maintain the decorum of the class, to maintain the proper norms of the class, you can say, and if it is possible, the for the better student teacher interaction, and if the teacher is able to remember the names of the students and to call the students by the name, that gives a very good boost up for the students and in the teacher teaching also. Another skill which is very much important nowadays is the teacher must be well versed with the use of the audio visual aids. So till now we have seen why micro teaching is needed, what are the core components of the teaching, or you can say the core skills. Now, what are the different steps of the micro teaching, which is the today's class. So the first and important step is to define the skill. Like we decide which skill we are going to improvise or which skill we are going to practice. So we must define prior to the micro lessons the skills to be practiced. Then second is planning a micro lesson. We must plan how to teach, what to teach, and next is teaching a micro lesson. Then after teaching a micro lesson, the feedback, constructive feedback is given by the peers and the experts, and then next comes the phase of replanning, then again reteaching, refeedback, and this cycle keeps going on. So the first step is the defining the skill. That means the skill which we are going to practice must be decided beforehand. In the second stage, the skill which we are going to practice, appropriate knowledge about the skill which we are going to demonstrate must be gathered through the lectures, demonstrations by the experts. Now, when we plan a micro lesson, we must decide what we are going to teach, the content, how we are going to teach, and how we are going to demonstrate the skill. In the micro teaching session, when it is done, you know that it is done for a small group of students where the peers and the experts they act as a student. Then again the phase is of the evaluation and the feedback by the students, and the feedback, it can be supported by the video recordings to improvise, and the teaching cycles here are usually of 15 to 30 minutes in duration. So this is the micro teaching cycle. So step 1 and 2, we know that we have to define the skill, then we gather a knowledge about the skills to be practiced, then the lesson is planned, then the teaching the micro lesson for a period of 6 minutes, then the feedback is given, that is the constructive feedback by the peers and the experts. After getting the feedback, the teacher is asked to replan the lesson, keeping in mind the feedbacks and the comments in view, and then the lesson is the reteached for another 6 minutes, and again the re-feedback. So you can see that this is the micro teaching cycle. Now let's see the advantages of the micro teaching. Micro teaching has found to be effective in the growth of teachers' knowledge on teaching. Since it is under the expert supervision, the benefit of expert supervision and the constructive feedback helps to learn the new teaching aids, helps to increase the confidence and eliminates the error. And moreover, it enables to understand the behavior which is important in the classroom teaching. But there are some limitations also. The first and foremost is the time constraint, because the micro lessons has to be planned for the individual teaching skills. So to master or to practice the core skills of the clinical teaching, we need to practice multiple sessions of the micro lessons. Another limitation is that the in a micro lesson only individual teaching skills are practiced, but the multiple skill integration in an actual classroom is difficult. Practicing multiple skills integration is a difficult situation. Then the real complexities of the classroom teaching is difficult to simulate in a micro teaching lessons. Now let's see the differences between the micro teaching lessons and the traditional teaching. So here the number of students in the micro teaching are less, around 5 to 7, and in the classroom teaching it's a one batch the students. The duration is less, for about 5 to 7 minutes. Here in traditional teaching the class is for a period of 45 minutes to 1 hour. Then if we see in a micro teaching session, the single skill is practiced at a time, but in traditional teaching, the multiple skills are practiced. Feedback is an important component of a micro teaching. However, there is no feedback in a traditional teaching. If you see the situation in a micro teaching where the peers and the experts are your students, the situation is definitely under control and it is conducive. But in a real classroom teaching, there is a no control over the situation. The if you look at the complexity of the micro teaching is relatively simple, but real classroom is a different world. It is a different situation, complex, or you can say it is a complex situation. Content is not of any relevance in the micro teaching. It is the teaching skill which is important in micro teaching, but however the content is important in the micro teaching. Then for the micro teaching, we get the chance, or you can say we can practice multiple sessions, but in the classroom teaching there is a no scope to practice again the same lesson. With this, I come to an end of this video. Thank you for watching this video.